Donald Trump's physical and mental health is collapsing at the worst possible moment in his life and for this country. While we're in this disastrous, unlawful war in Iran, we're seeing clearer signs by the day of Donald Trump's deterioration. In the past 24 hours, Donald Trump left his cabinet and top staffers baffled by what the hell he meant when he held a press conference and started to say that he got a very big present from Iran. He said, they gave me a gift. It was a big, beautiful present. And it showed me that I'm talking with the right people. It was a great gift. And from all of the reporting inside the White House, his staff and his cabinet was left absolutely baffled. And now the leadership in Iran has been responding by mocking Donald Trump for saying, we got a gift. I mean, the war rages on and escalates by the minute. And this is what he said. First, let me play you what he said in the Oval Office. Then I'm going to show you Iran's response. And then I want to show you another very alarming moment over the past 48 hours. But first, play this moment in the Oval Office. Let's play it.
Because they're going to make a deal. They're going to make a deal. They did something yesterday that was amazing, actually. They gave us a present, and the present arrived today. And it was a very big present worth a tremendous amount of money. And I'm not going to tell you what that present is, but it was a very significant prize. And they gave it to us, and they said they were going to give it so that...
Now, Tehran responded. The Islamic Republic responded by putting out a video right after that on Iranian media saying, here's the gift, Donald. Here's the gift we send Trump. And this aired on Mehr, Iranian state regime media. Here, play this clip of what they did right after that. So let's play. I mean, they're mocking him in the Oval Office right now. He's posting memes like this, greatest president ever, these weird AI photos of him dressed up in a tuxedo. He's been making social media posts where he will attack James Tallarico, the Democratic Senate candidate in Texas. And then in the same sentence, he'll start talking about California Governor Gavin Newsom and say, Newscum, and then say he's dumb and he's a total racist. And he's all over the place with his thoughts. And then he visited Graceland. He's got this obsession with Elvis, and he shows up, and as Aaron Rupert says, this is your wartime president, folks. Here, play this clip.
Yeah. It's a great honor. Hold it. Has anyone tested this pen yet?
I think you're the first.
Should we just right give me a piece of paper just to make sure what level the ink is,
yes.
Right? It's a lot easier to do that way than ruin the guitar.
Exactly.
Okay, not bad. Okay, ready, everybody? Let's see here. Oh, that came out good. Look at that.
Yeah, that looks nice.
Wow. You never know. These are hard to sign. But that came out pretty good.
Is that the first guitar you signed?
Just about. Now, Biden couldn't do that. He'd have to send it out to be signed.
This is serious. I mean, that dialogue looked like a nurse treating a patient in hospice care. The way she was speaking to him, that interaction, I mean, that's deeply disturbing that that's the individual, it's the commander in chief right now, while America's in this very avoidable quagmire in the Strait of Hormuz as we're sending thousands and thousands of troops paratroopers from the 86th Airborne Division, Marine Expeditionary Units on the USS Tripoli, other Marine Expeditionary Units apparently prepping for a ground invasion. And this is what he's doing. I want to bring in the leader of Midas Health, Dr. Vin Gupta. Now, Dr. Gupta, you and I have been covering this for quite some time, and it's been getting worse and worse and worse. I want to get your take, your observations of what you've been seeing there and just in general, Doc.
Yeah, Ben, I saw the tweet on criticizing Tallarico and then Governor Newsom and then others. And, what really struck me, just purely recognizing again, I'm not close to the president physically. I haven't examined him, but a lot of these things are obvious. Just the way in which we had a lot of armchair experts weigh in on President Biden and thought they were medical experts. In this case, I think the precedent has been set that we should expect a transparency when it comes to a president's health. And if there's something that's worrisome, and there's obviously multiple data points here that are worrisome when it comes to Trump's health, that we should be able to talk about it and to ask questions. And that's what you and I have been doing now for 6-7 months now, asking questions, wondering why there's all these inconsistencies. And so when I look at the Tallarico to Newsom to VP Harris, that sort of progression of rambling thoughts, when you think about the fact that he has disorganized thinking just in general, he has fluctuating alertness. He falls asleep at inopportune times, in the middle of a cabinet meeting. But then he had this really just wandering thoughts, difficulty, if you're just reading that tweet, difficulty following one train of thought, goes and tries to criticize 3 separate people. There's nothing connecting any of those individual thoughts. It does make you think. This is somebody who has difficulty with recall. He doesn't remember basic things often unprompted. He jarbles his words often. He's confused. He has these wandering thoughts. And then there's fluctuating alertness. He has, and the other data points too. We've seen the fact that they like to cover up parts of his body. Why does this part of his hand, why does that look like there's always makeup on it? So there's all these questions, plus all the confusion on whether he got a CT or an MRI, which was complete nonsense here. That should have been clear from the start. So they're creating questions, not answering them. He is himself. But I wonder, his dad had a history of Alzheimer's disease. That's what he died from, or part of what contributed to his demise. And again, when you think about memory loss, when you think about confusion, wandering thoughts, just how he conducts himself, you do wonder, does he have significant cognitive dysfunction? Does he have one of these diagnoses? What's actually going on? This fluctuating alertness, could it just be the fact that he is getting older and is in a demanding job? Sure, that's what many people are going to say as justification for that. Okay, fine. The previous occupant of the White House, if he did the same thing, would have been held to a different standard, different scrutiny. A lot of questions and demands for medical data would have been had from, frankly, the mainstream media. We're not hearing those things. So I think the fact is we're not hearing a lot of questions being asked of this president the way the same questions were asked of the prior president, which is wrong. Same standards should apply. And then last, I'd just say, he tends to personality and speech changes, often inappropriate comments. That's frontotemporal dementia for some people as they get older. And so I can't diagnose him because I don't have a physical exam. I will clearly say that because I know some people will watch you and I having this conversation and push back. We're asking questions, but I think it's fair to ask the question that the leader, so-called, of the free world cannot string together some basic thoughts on social media when he's had time to think about it. It's rambling. He often has fluctuating alertness, and he is random and is prone to inappropriate comments and behavior. That is not normal aging. necessarily. That is potentially, especially with his family history, potentially something else. And especially because they've been non-transparent about his medical diagnostics and exactly what's going on there. I think it's fair for us to ask these questions.
Right. If that wasn't Donald Trump, if somebody presented at a hospital where you were making your rounds for the night and, they started behaving that way, and then you asked, okay, well, tell me a little bit about the family history, and a person who was a family member then said, well, this person had Alzheimer's, this person had Alzheimer's. And then the person started, saying, you got a gift. I got this person a gift. And it was a beautiful present, And I don't like that, and they just started behaving that way, setting aside Trump. If someone behaved that way, I'm not going to put words in your mouth, but the types of questions you would go towards is what?
Exactly what you and I just went through, which is, are there issues with memory? Because often memory loss is the first and most prominent symptom of, say, Alzheimer's disease, which we know runs in the family to some degree. Does the patient, let's say patient next year, are they prone to confusion? Are they prone to wandering, seemingly random thoughts that are disconnected? Do they have difficulty following a basic conversation? Can you often understand their train of thought? These would be the questions. Do they have fluctuating alertness? Do they have disorganized thinking? Personality and speech changes? This is quite literally some of the questions you would ask somebody with a family history acting in a certain way. And when you go through that and you look at what you presented in the tee-up, then it's hard, if you're, again, being as objective as we possibly can be, not to say, well, gosh, I'm checking that box, I'm checking that box, I'm checking all the boxes here. Is something wrong? And to say that this is simply, and his supporters and those that don't want to look at the facts, or those that readily called out the prior occupant but want to defend and look for any justification not to ask hard questions with the current occupant, how do you look at that series of questions and not say to yourself, well, gosh, maybe something is actually happening? Why are they covering up his hand with makeup? Why does his own physician not know that he got supposedly a CT scan and not an MRI, which was the claim for many, many weeks? How are these basic things not known? And why is it, if you were to go through a basic neurologic review of symptoms and systems, if you were to ask those basic questions, Ben, anybody that does not have a bias would say, yes, something here is off, especially with the family history, and particularly because his own physicians don't even know the tests that he is and is not getting.
While we're on the topic of this disastrous war, it's catastrophic for lots of reasons. The human toll, our own troops, the people in the region, innocent civilians who are getting killed, just as we saw in Gaza, as we're seeing in Lebanon, as we're seeing where schools are being blown up by the military and little girls are being killed in mass. Also, this is coming at a time where healthcare is being ripped away from Americans. You and I had been covering this as well, and you've been on the front lines covering this in Midas Health, and also in the work you do with California Governor Gavin Newsom and the Health Alliance, trying to fill in the gaps from the fact that the Trump regime destroyed our health infrastructure. And so we've been told in this country, Doc, that we don't have enough money to help people with healthcare, to continue the Obama subsidies that were so helpful for people's lives. We don't have enough money to lower healthcare costs. And then they're like $200 billion for more missiles to blow up elementary schools. And as Pete Hegseth would go, we loiter over the skies. We rain down death. Our negotiation is bombs. And I think about the inhumanity of that. Yes. I also think of the inhumanity here at home of this could have been people's healthcare. How many people are dying because they can't access healthcare? And this is what the money's being spent on. Before we go, I want to hit at that point.
Yeah, I know. Thank you for doing that. This is a great time for anybody and I'd say regardless of party lines, but we know who will and will not do this, to talk about the public option then, because this has been something that a vast majority of Americans are in favor of. The public option doesn't have to be Medicare for all if people aren't in favor of that. But the public option is basically the government guaranteeing that if you don't have employer-sponsored health insurance, if you don't qualify for Medicaid or traditional Medicare, the government will still be there for you. And for whatever reason, this has not been prioritized because back in the day, President Obama tried to get this passed, and there was not enough senators to pass a public option. Now we're seeing this is what an opening for people running for office right now. And I'd say for any Democrat, especially, talk about it. We're not hearing a lot of people talk about, hey, what are you going to do when it comes, if you're in Congress tomorrow, what are you going to advocate for when it comes to healthcare? It's pretty vague. This is an obvious thing to rally around, Ben, the public option. And I know it's something that Governor Newsom and others, leaders like him, are in favor of, strongly in favor of. There's no reason not to be in favor of it, because up until now, you beautifully said this, people have said, and those senators that are against it have said, oh, it's going to bankrupt the United States of America. By the way, what Hegseth and others are asking for Iran, $200 billion over the next just 3 months, would easily cover a public option in the United States for years. So let's not use that as an excuse anymore, number one. Number two, there's many analyses, Ben, showing that if we actually had a public option for people that didn't qualify for traditional Medicare, Medicaid, or were not employed, that it would actually save the system money because they'd have primary care. They'd get timely care if they were sick. It would save, say, an ICU stay where people come, unfortunately, and see somebody like me. That costs the system way more money. So we'd actually be cost saving while keeping people healthier. There's no reason not to talk about this. And I'll lastly just say, Kaiser Family Foundation, leading think tank in healthcare in the United States, just released a survey. Over 1 in 10 people have already scrapped their Obamacare health insurance since the turn of the year. And we're expecting many, many millions more to do the same because subsidies are actually increasing. This was not abstract and just a fear, something that we feared towards the end of last year. This is happening in real time. I am seeing, as are my clinical colleagues, the downstream consequences of that. Delayed medications, not picking up your medications, not getting critical cancer screenings, ending up showing up to the hospital with flu in a severe form because they didn't go in when it was early flu. Things got complicated and became far more severe, and a hospitalization was rendered. We're seeing delayed diagnosis, delayed preventive care, and not picking up medications. That's what's happening, Ben, across the country. And it doesn't have to be that way. But if we're making choices, we're making a clear choice right now on how to spend $200 billion for 3 months. And that money could be repurposed very easily to cover a public option and everybody that wants healthcare in the United States who does not have it for years. And that's the stakes.
Dr. Vid Gupta, thanks for breaking down the stakes, how serious they are, and a lot about what's on people's mind now regarding Trump as well. Thanks as always.
Thank you.
Everybody check out Midas Health, which is led by Dr. Vin Gupta. He's been doing great work with the Health Alliance run by California Governor Gavin Newsom as well. And everybody hit subscribe here. Let's get to 7 million subscribers.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.